Okay, today we're going to go over a postpartum and a newborn assessment. And my name is Sally, and Shauna's going to be helping today. So we're going to do your postpartum assessment, Sophia. I am going to raise your bed for body mechanics, and I'm going to, do you want to be sitting up a little bit here?
A little bit, good.
Okay, just a little bit.
Thank you.
And I'm going to do my hand hygiene, and I'm going to put on gloves for your safety. And today we're going to be doing an assessment, and that just means I'm seeing how you're doing. How are you feeling today?
I'm feeling good.
Good. And thank you for getting up and emptying your bladder before we did the assessment, and putting on a clean pad, because we're going to want to check your drainage, your vaginal flow, and so we want to start with a clean pad.
Okay.
So what baby was this for you?
It's my very first baby.
Oh, congratulations.
Thank you.
And you delivered vaginally yesterday, so you're post-op day one, postpartum day one, right?
Yes.
Okay. So, so for your safety, I'm going to start off and I'm going to ask you for your name and date of birth.
Sophia Rodriguez, April 12th, 1999.
Okay, Sophia, and can you tell me, are you allergic to anything?
No.
Okay. All right, so I am going to pull the curtain for your privacy, and we're going to go ahead and start with your breasts. And you are breastfeeding, correct?
Yes, I'm trying.
Okay. Well, you know what? I'm here to help you. And so anytime when you breastfeed, just call me, and I want to take a look at that latch and see how baby is doing. We want baby to have most of the areola in his mouth, and there shouldn't be any dimpling. Sometimes we have to work at it a little bit. When your mouth does come in, you're going to want to actually today put on a well-supporting sports bra. Okay?
Okay.
Let's just take a look at your breasts.
Okay.
And I'm going to gently palpate here.
Okay.
How are they feeling?
They feel okay. It's a little tender when I latch him, but the lactation consultant came and helped me.
Good.
But
Good.
I'll call you the next time I'm ready to feed
Good.
him.
Your breasts will fill up quickly, and that's a good thing. It's a supply and demand kind of response. And now I'm looking at your nipples, and they look intact. How are they feeling?
They feel fine except for when the baby latches. It hurts a little bit.
Okay, and that's normal. They shouldn't hurt throughout the feeding. Sometimes as baby's getting that latch initiated, it can feel kind of like an ouch, but that feeling of pain should go away. One thing that's really important is that baby grabs hold of most of the areola. We want that mouth nice and wide open. And sometimes if they grab just the tip of the nipple, we can get actual skin breakdown. And if that happens, let me know. We can, remedy that with certain things. But most of the areola and the nipples look great, and the breasts are nice and soft. So I would put that sports bra on today. Okay. The other thing is you might notice that colostrum is coming out of your nipples right now. And if you manually express, you can see it's kind of a yellowish color. And that is liquid gold. It's high in protein, sugar, and antibodies. Again, doesn't have a lot of fat content in it, but it's so good for baby. Once your milk comes in, so colostrum's kind of precursor to the milk. Once your milk comes in, usually in a couple days, it will have a higher fat content. It is more of a white color, and again, you'll feel your breasts are even heavier. But not to diminish the power of colostrum, because that is pretty important for your baby. So let's move down here, and we're going to go ahead and check your fundus, your uterus. And fundus is just the top of your uterus. And so I'm going to kind of palpate here with my fingertips. I'm going to start at the umbilicus. And since you delivered yesterday, usually it descends about a centimeter or a finger breadth each day postpartum. Okay. Your uterus goes from holding your baby down to the size of a fist. So that's a lot of contracting that has to happen. And you might notice when you breastfeed, we know that Pitocin is released from your posterior pituitary. So you're going to have contractions when you nurse, and that's okay.
Okay.
So have you noticed discomfort with like contractions after delivery?
Well, I noticed cramping. They don't feel as bad as the contractions during labor.
Good.
But like menstrual cramping, like when I have my period, when I breastfeed the baby.
Okay, so that's totally normal. And I'm going to go over to this. So an important assessment, a focal assessment that we're going to be doing is reproductive, which involves the uterus, the top of the uterus, which we call the fundus, and the perineal areas. So we're going to kind of zoom in on that. One of our priorities is we want to assess our patient's fundus, which is the top of the uterus. And depending on when they've delivered, if they're right at delivery, usually it's about at the U or a little bit above. And depending on how many days postpartum, it descends into the abdominal cavity and is undetectable about day 14. So if our patient was about 1 day postpartum, actually this fundus is midline and it's 2 finger breaths below the U. The other thing is the uterus, the fundus should be midline. It should not be deviated to the right or left. A full bladder can actually do that. A full bladder can keep it from contracting as well. So this one is midline, 2 finger breaths below the U. And again, to check that, you're going to use your fingertip pads, and you do have to kind of palpate a fair amount to assess that. Keeping in mind, if your patient has an abdominal incision, you might want to, be a little bit, be aware of that and tell them that. And then we also want to provide that support by the symphysis area when we're massaging and checking the fundus. Okay, so this fundus feels a little bit boggy. If you want to feel your nose, that's boggy. Firm is your forehead. We want it to feel firm. And this one feels a little bit boggy, so I'm going to go ahead and massage it, and it firms right up. The other thing you can do if your patient's boggy, maybe they have a full bladder, they need to void, and that will help it contract down. You want to educate your patient about your fundus. It goes from holding a baby, 7, 8 pound, 9 pound baby, to the size of a fist. So it has to contract down. Usually first-time moms, primips, they don't feel those contractions very much. The more babies you have, the more they're going to complain of those cramps. We call them after pains. And you may medicate them with some ibuprofen, an anti-inflammatory, or Tylenol, or a warm pack for that pain. Okay, so again, you're going to want a location. Is it deviated to the right or left? Is it midline? And where is it in relationship to the umbilicus? Is it boggy or firm? Those are your assessments. So as we're checking your uterus, now we're going to go down to your lochia. And lochia just means vaginal discharge. And again, we know that you can have a discharge for up to 6 weeks. It should decrease in color and amount. We don't want you to soak a pad within 15 minutes or an hour. How would you describe your vaginal discharge, Sophia?
It's red, and it's like a light period right now.
Okay, that's good. Remember, when you get home, if you notice an excessive amount of bleeding, like I said, soaking a pad in 15 minutes to an hour, you'll want to call the provider and let them know. Okay? So I'm going to take a look at your lochia right now. And after sometimes rubbing on your uterus, you might notice a little bit more discharge, and it looks like a scant amount of red-brown color. We call it rubra, and that is normal for 1 day postpartum. Okay? So how is your perineum? How's your bottom feeling?
It's a little sore because they had to put some stitches in it. I guess I tore.
Okay, so I'm going to go ahead and look at that if I can. I'm going to have you turn over on your left side and put your leg up, and I'm going to visualize your bottom. Okay. So let's go ahead and turn you. And then when we're looking at the perineal area, we want to get them on their side with their top leg kind of flexed. We call it Sims position. And we're going to look at the perineum. And that is the area between the anus and the vagina. That little area is a perineum. Sometimes they may rarely have an episiotomy. They may have torn or have a laceration. The perineum is a very tender vascular area, so we have to teach mom about good peri-care. We want to keep the area clean, warm, and dry. So that peri bottle front to back with warm water. You may use some anesthetic spray. You may use some Tux pads to decrease swelling, and you want to teach mom about that. One thing I can notice in her anal area is she has a hemorrhoid. And that's that little pocket. And they can be internal or external. And they hurt. Some patients don't feel them at all. Other patients do. And again, it's important to remember to keep that stool soft, lots of fluids, fiber, and we may be giving our patient a stool softener or something to help them actually have a bowel movement if the hemorrhoids are bothering them. Another thing that can happen is if our patient did have a repair of some type, we want to look at that perineum for Rita. Is it red? Is it swollen? Is there any discharge? Is it healing nice? Pain should be getting better, not worse. If it's getting worse, that can be a sign of an infection. Okay, so that's our focal assessment of the perineum and the uterus. Erythema, discharge, approximation. And it looks okay. It looks like it's healing nice. The area is reddened, but it is healing. It looks like it's healing okay. So remember with your laceration that you had, we're going to want to use the peri-bottle front to back, ice to your bottom for the first 24 hours. And we have also some Dermaplast spray if you need that. Okay.
So they told me that when I was delivering that they saw a hemorrhoid, but I don't feel it.
Yeah, hemorrhoids can be very uncomfortable. Again, what we want to do is we want to increase our fluids and eat a lot of fiber and keep our stools nice and soft and regular. Sometimes labor and a surgical delivery, a C-section, can slow down peristalsis. So we want to, again, do those measures to ensure that you'll have a bowel movement. We're giving you a stool softener. It doesn't make you go to the bathroom, but it keeps your stool soft.
Oh, okay. That was that red pill they gave me?
Yeah, clear red pill. Okay, so remember, drink a lot of water too. Okay. And again, if the hemorrhoids start to get uncomfortable, let me know and we can give you something for that too. Okay, so we've done our breasts, our reproductive, and genitourinary is the next. So tell me, how frequently have you been emptying your bladder?
Well, they told me to empty it every 2 to 3 hours. So when I'm ready to breastfeed the baby, I get up and I empty it at that time. So I remember.
Excellent. And we're going to want to check color, amount. Do you feel like you're emptying your bladder fully?
Yeah, I don't feel like I have to go after I pee.
Okay.
And it's red, but I think it's because I'm bleeding.
Yeah. Okay. Well, I'm going to take a look at it. We're not going to measure it anymore because your IV's out. But again, we want to make sure you feel like you're emptying it after fully emptying your bladder. Okay. Your body builds up to 50% more blood volume with pregnancy, and after you deliver, your body rids yourself of that. And so on the first few days of postpartum, you're going to notice a lot of urination and maybe even some sweating, and that's normal. And have you noticed any swelling on your feet?
Yeah, my feet are swollen.
Yeah, that swelling of your hand and your feet is totally normal. Again, as you diurese, we call it, or as you void urine, you're going to get rid of that fluid. Okay? And so I'm going to check your bowel sounds. Now, Sophia, if you had a C-section, we would also, a priority would be to check the incision or the dressing, which could be a variety of could be an Aquacel dressing. That's the most common one that I've seen. And we're going to want to look at that and see if there's any redness, discharge, or odor, meaning infection. But you don't have any abdominal incision. So I'm going to go ahead and listen to your bowel sounds. Now, are you passing gas?
Does that mean farting?
Yes.
Yes.
Good. That's a good thing in postpartum. And again, that's important for our surgical patients because that is a good indicator that they can start eating food. Okay, so that's good. And I'm going to listen here to your bowel sounds. And they're very loud, very active. Good. And sometimes the process of labor and delivery, and again, a surgical delivery, can slow down peristalsis. So it's really important to, and how's your appetite feeling?
I'm hungry all the time.
Good. That's good. Because you're also lactating. And so we want you to have more calories, and don't forget that fluid. I could never say that enough. Lots of fluid. Okay. So have you had a bowel movement yet today?
No, I think I pooped during delivery.
That's okay. That's
But
okay.
I think that's why I haven't gone again.
That just means you're moving the correct muscles. But remember, we'll be asking you, you don't need to have a bowel movement before your discharge, but we will, want to make sure you have one. And what is your usual pattern as well? Okay, so I can see that you are getting up okay. Do you feel any dizziness when you get up?
No.
Okay, just remember to kind of sit at the side of the bed before you get up. That's especially relevant during shortly after delivery, because sometimes with the fluid loss and the blood loss, you might feel a little woozy, but you're actively moving and getting up to the bathroom, so that's a good thing. We talked about edema. Markings of pregnancy. Have you noticed? I can see a couple of striae gravidarum on your abdomen, and I do see a little mask of pregnancy on your face, and those are normal. They should fade away in a period of time. May not completely go away, but they should fade. Okay? All right, so now we are going to go to your emotional status. So I've been assessing this. Do you have help at home?
Yes, I live with my husband, and my mother-in-law lives with us.
Good. Okay. Are they supportive?
Very supportive. Yeah, she is very excited. It's her first grandbaby.
Excellent. And we know too that, with pregnancy, a large majority of patients feel like the blues, they call them, the postpartum blues. And that's related to the hormonal shifts that are going on. If you feel like the blues persist past a couple of weeks, you will want to let your provider know. But it is normal to be happy one minute and then maybe tearful. Did your delivery, was it what you wanted, what you expected?
Yeah, it went really good. I did end up getting the epidural, but not until later.
Good. Okay. So you live with your support systems, and good. So that sounds encouraging. And if you need anything, let me know. And just again to emphasize that if the blues persist past a couple of weeks, we'll want you to follow up with that. Okay?
Okay.
All right. The last thing I'm going to take a look at is your legs. So we said a little bit of swelling here. Your toes are pretty. I'm going to check the back of your ankle. Do you have any pain there?
No.
I don't see any redness. What we're checking for is a DVT, a deep vein thrombosis, or a clot. And we know that with pregnancy, your blood clots better, more effectively, and that's a good thing. But again, with not moving around as much, your at risk for that. And that's why we had those compression devices on with the epidural. So I'm looking, you said there's no pain, there's no redness, there's no ropey feeling. So again, it's important to walk around and be mobile. Okay, and speaking of pain, we did your vital signs. Well, how would you rate your pain on a scale of 0 is no pain, 10 is the worst pain you could imagine?
The only time I have pain is the cramping when I breastfeed, and it's probably like a 2.
Okay. And what is your acceptable level of pain, Sophia?
Maybe a 4.
Okay. When you breastfeed, you can also, remember, you can take Tylenol or ibuprofen before you breastfeed. We can also put a warm pack on your tummy when you're going to breastfeed. That kind of helps the cramping. And like I said, that's adaptive that's happening. Okay. Do you have any questions or concerns?
No, you answered all my questions. Thank you.
Okay. Remember, when you're doing a postpartum assessment, an easy way to remember it is an 8-point assessment, bubble E. What that stands for is breasts, uterus, bladder, bowel function, lochia, episiotomy, laceration, or maybe there is none. Maybe she delivered intact, but you still want to take a look at that perineum. Legs, and that's again to check for thrombophlebitis. And then the E is emotions, and that's really an important part of our assessment as well. So that's an easy way to remember that in terms of your physical assessment. Sophia, do you have any other questions?
No, I'm good. Thank you.
Okay, I'm going to take my gloves off and I'm going to practice hand sanitizing for your safety. And so your call light is available. And if you need anything for pain when you breastfeed baby, let me know. I'm going to be checking on you every hour. I'm going to put the side rail up for your safety. Any concerns, any questions?
No.
Okay, we'll see you in about an hour.
Thank you.
Thank you.